Well, we are going to talk about the hot topic of mental health. And we got a really great panel lined up for you. And I was thinking, not everybody, when we talk about mental health, means that they're off their rocker, as we used to say. And it doesn't mean that it's old people. It includes young people. So it goes between ages, races, income level, all of that. You know, you could be the richest person and then you have a problem. You can be a poor person and you still have some kind of issue with mental health. So with us today we have our, starting right here, Mr. Mitch Lucas from the Detention Center. And I'm sure he can tell us all about the population that he has. Our coroner, Ray Wooten, and Ms. Jennifer Roberts with the Charleston Berkeley Mental Health Center, and Christy Wright from the Charleston Center. Okay, so who wants to open up first with mental health?
I'll be glad to.
Okay.
I am the jail administrator for Charleston County, and as such, I run the largest jail in the state of South Carolina. And I also run the largest mental health facility in South Carolina because of that. And that is true across the country. 20% approximately of all of the inmates in jail at any given time are on some type of psychotropic medication. Sometimes a little lower, sometimes a little higher, but usually about 20%. Beyond that, the folks that are not on medication, overall, the estimates, and there's no clear way to do this because when people come in if they're mentally ill, they don't always let us know. Sometimes we discover it, sometimes we don't. But somewhere between 40 and 60% of all of the inmates in this country suffer from some type of mental illness. And to compound that problem, the vast majority of them also have a substance abuse problem that goes along with that. Now, when it comes to dealing with the mentally ill, the severely mentally ill, and we have a number of them that never spend more than a week out of jail. They get out of jail, they don't see the folks over at Dorchester Mental Health. They get out of jail, they exist for as long as they can without doing something that someone calls the police on. And so the police have nowhere to take them except jail. They bring them to jail. The resources that we've got over there, we have 4 mental health workers, and I think about half an FTE that sort of runs things, Tamara Starnes. But with the population numbers that we have, which right now, and for some reason, and nobody's been able to put their finger on this, most jails in the country, the population has been declining for 3 years. Excuse me. We're down to just below 1,500 inmates. 3 years ago, we actually broke 2,000 on a couple of different days. But with only 4 mental health workers, all they can do is put out fires. We have a number of people who come in, and if you say, I'm thinking about hurting myself, I'm thinking about committing suicide, then you become a priority with mental health. As far as real treatment programs, we just don't have any, and we don't have the resources to do this, and we've been working on this for years. We have a psychiatrist that comes to the jail, I think 16 hours a week, possibly 20. We adjusted that contract, and we moved it because of the prescription issues. We moved it from Charleston Mental Health to the medical provider. And he comes in, and really the only reason he's there is to write prescriptions so that we can provide the appropriate psychotropic drugs to the folks that need it. It's a situation that is from one end of the country to the next. I'm not any different than any other jail in the country. There are about 180 jails in the country that have more than 1,000 prisons. So I have resources. If you can imagine, if you were in Marlboro County and dealing with the same issues that I would deal with, and they do, well, how do they do it? So we're fortunate that, first off, that we've got Charleston Dorchester Mental Health is a resource that I can't say enough good things about. It's the same as Deotis and Charleston. I also have 6 folks from Deotis that work directly at the jail. And these are pass-through contracts. I just pay, the county pays for the cost of the people that work there. There isn't any administration fees from Charleston Dorchester Mental Health or from Deotis. This is just pass-through fees. And they want to have more people over there. I want to have more people over there. We just haven't figured out a way to do that because the jail is the most expensive proposition in Ship County government. We eat up more of the budget than anybody else does. It's expensive to take care of people. And the mental health issues are extremely expensive too. But we have managed to help a few. We're working closely with the VA now. The VA has a Veterans Justice Outreach Program that we have a woman who's working with us and placing people. I think in the last 2 years she's placed about 40 people that were homeless into shelters or into residences that were designed for veterans that were homeless and having problems. And most of the homeless people that you see in Charleston have a mental health issue to go along with it, and it contributes to their homelessness. And I don't want to take up too much time. I just wanted to lay the groundwork for, if you're looking for the mental health facility in Charleston County, it's at 3841 Leeds Avenue. I mean, that's just the sad fact of it. Later on, I'll tell you something about a law that was passed that might change things a little bit, but in Charleston County, it's about the only county that's in a position to do anything about it, but I'm going to let somebody else
Okay,
talk.
I need to say something. I forgot to thank Mr. Herbert and Margaret Covington. Is that the right name, last name? These 2 people provided us a beautiful dessert table over here. What is it, peach cobbler? Apple cobbler. Y'all smell that in the room when you came in here? So I don't want y'all to be, please feel free to go and help yourself. And he told us that we needed to bring some ice cream so you could have Alamo pie. So by all means, help yourself while we talk about this, okay? And I thank you for opening up with that. I guess I really wasn't seeing, I talk all about, we talked about insanity in Bull Street a long time ago. Which is gone, y'all know Bull Street. I don't
It's still
y'all.
there.
It's still there. We just don't talk about it.
I used to work there.
Okay, all right. And so now you're saying that most of the people in the jail, you have some kind of mental illness.
And there are a couple of state facilities, but I guess it was the 70s, when they started changing the way they treated them, instead of just warehousing them, they were going to put them into the community and they were going to provide treatment. And that was fine, that was a great idea, except the mentally ill folks they don't follow through with these things. And one of them told me one time, a long time ago when I was a deputy, that when I take my medicine, I act normal, but I feel terrible. When I don't take my medicine, I feel normal, but I act terrible. And that's a big part of it, but we're asking people to keep appointments and keep in touch with mental health workers. And maintain a job or take their money and do what they're supposed to with it, and these folks just aren't capable of it. So there are some state facilities, but the vast majority of people who are mentally ill are not a danger to themselves or others to the degree that we can have them committed, so they end up going into the Piggly Wiggly and not leaving, or going in there and starting to eat something because they're hungry. And there's something to eat there, so they go and eat something, and then Piggly Wiggly calls the sheriff's office, and they get arrested for trespassing or petty larceny or shoplifting, and they end up in jail. And then as soon as they get in jail, they start breaking the rules. I had a young woman who, she was about 19 years old. She came in for shoplifting, and within 45 minutes, she had hurt 2 detention officers and broken a sprinkler head and had swallowed part of it. 45 minutes after coming in the door. And that's almost